Hello, this is Dr. Kavian Milani for Virginia Medical Updates. In the previous section, we did talk about obesity, and in this session, I do want to address the issue of obesity, why it's more prevalent in society today, and some ways in which we can conceptualize and understand the rising epidemic of obesity. As you know, as we all know, obesity leads to hypertension, hypercholesterolemia, it leads to renal disease, it leads to liver problems, and it does lead to a variety of cancers. In general, it is very important for physicians and for the patients and for all parties that are interested to begin to conceptualize this issue of obesity along the spectrum of other medical problems. The issue is not really losing weight or to just basically look good. The issue is that the processes of obesity, the process of weight gain, of excess weight, does actually lead to significant medical problems. And we, in this program, want to bring this awareness to the community. And I want to be able to engage in a dialogue with the community on how to tackle the issues of obesity and weight gain. If a person wants to lose something akin to 10 pounds, for example, we have to keep in mind that every 1 pound that we want to shave off, that we want to get rid of, every 1 pound is equivalent of 3,500 calories of energy that we must either not consume or we must burn. Well, for every 1 mile that one jogs or runs, one can only burn about 100 calories. So it stands to reason that to burn 1 pound, one has to jog something akin to 35 miles. And that is a significant amount of calories that one can burn, but at a very, very difficult rate. So it is important to notice that any weight loss program has to be balanced between losing calories and increasing muscle mass and burning fat, but also in terms of reducing the intake of calories. A number of programs have been very successful. A number of commercial programs have been very successful. A number of fad diets have been very successful. And in general, any of these programs, if maintained and if accompanied by adequate hydration and by adequate exercise, can lead to sustained, successful weight loss. But the difficulty is this, is that as one loses 10 pounds of weight, the hormones in the body begin to move to produce homeostasis, and the two hormones that I'm thinking about are leptin and ghrelin. And these hormones, as their levels begin to go up, they begin to slow down metabolism, they begin to actually increase our requirement for eating, and they force us to become ravenous and eat more and more. As this happens, then weight loss becomes much more difficult to maintain. And so a number of tools are available for physicians to use to manage this surge in ghrelin and this increasing in appetite. In addition to the medical and pharmacological management, normal substances that are available, like green tea, like lightly brewed coffee, like a variety of peppers, are available to enhance metabolism. And as they enhance metabolism and increase the metabolic rate, it becomes easier for the body to actually burn some of these calories off. The CDC now recommends, and it's important, that if one wants to engage in intense physical activity, that a total of 75 minutes per week is used. And that then has to be accompanied with some activity like in the form of jogging or running or singles tennis, which is intense, and then weightlifting and weights to be added to it. But for moderate exercise, then, which burns at a lower rate, then the CDC recommends a total of 150 minutes per week. And again, this is like doubles tennis or it is fast-paced walking, during which one can burn calories. So at a rate of 150 per week, then that's about 30 minutes, 5 days a week. And my experience has shown that if someone is actually walking at a fast pace for 30 minutes, 5 days a week, that they will lose weight and will bring their weight together and increase their body mass in an appropriate way. In the next program, I do want to address the issue of prediabetes and hypertension and how significant weight loss can contribute to preventing these disease states. Thank you for your participation with us. We look forward to hearing from you at 703-383-4VFM or on our Facebook page or through Virginia Medical Updates at gmail.com. Thank you.
Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of focus are on weight management, preventative medicine, and holistic health. Today we have with us Dr. Reza Eftehar. Thank you for being here with us today, Dr. Eftehar.
Thank you for having me.
Great. And Dr. Eftehar is the clinical director at the Metropolitan Headache and Spine Center in Alexandria, Virginia. He's also a clinical faculty member of University of Maryland's School of Medicine. And he is a licensed chiropractor through the state of Maryland and the Virginia Board of Medicine. His practice focuses on treating patients with migraines, TMJ disorder, spine-related injuries, and arthritis. So thank you again for being here with us today, Dr. Eftehar.
Thank you so much.
Great. Today we're going to be discussing scoliosis and the effects, early detection, and prevention of scoliosis in children. So tell us, Dr. Eftehar, what exactly causes scoliosis?
Well, scoliosis, for a lot of people, it could be from adolescence. And today we're going to mainly focus on adolescent, but I'll talk to you about people that overall, as they work with certain postures, and that'd be maybe for another segment, they start to their spines start to become scoliotic and become either C-shape or S-shape curvature.
So this is something that actually develops as a child grows?
Right, so it could develop as a child grows, or it could develop as people working on the computers, different postures, bad ergonomics, and so on. And usually especially the ones that as child grows, it could be where they're born with a certain genetic defect where it causes scoliosis. It could also be overall, right now kids are, in front of computers all the time, iPads and iPhones, and they're always crunched up, holding on to the phones, looking down all the time. Over time, they start to create a lot of headaches and scoliosis and spine curvature that changes over time.
Okay, so if it's a genetic disorder that they may be born with, is that something that if they're having those, sitting in front of the computer, is that going to make it worse? That's going to make it show up, or will it always appear?
Right, so great question. So number one is that obviously if they already have a predisposition to have scoliosis, they have a higher chance of making it worse if they already in bad postures and they're working on computers in a non-ergonomic fashion. Okay. So basically we want to make that least as possible, less chance of making it even worse, the case they're having. Now, depending on the scenario and the degree of the curvature, we can also correct that, and we can relieve some of the curvature. But if it's really bad, obviously surgery is definitely an option for that kind of case.
Okay, but how is it initially diagnosed? What sort of symptoms can someone find in their child or themselves?
Well, one of the most obvious one, Alejandro, would be the fact that you can see it on your child's spine. If his or her shirt is off, you can kind of see the spine's kind of crooked. You may see him or her leaning a certain way.
Okay.
That maybe you'd be wondering, why is he or she leaning to the right a little bit? His shoulders, you may be looking at him, you'll notice that one of his shoulders just slanted a little bit.
Okay.
And you may be looking further into that, and maybe he or she has scoliosis, or maybe there's some other problem that needs to be addressed with the shoulders, so you can address it that way. There's also DNA tests.
Okay.
There's actually a swab. You can swab anybody and figure out if they're gonna have scoliosis, if they already have it, and if they're predisposition to it. So that's some ways you can find out if your child has scoliosis.
Okay. Is it something that you would recommend for someone maybe who's looking to have children and have that DNA test run prior to that?
Well, I wouldn't really worry about that. If you want a child, usually doesn't matter. It's not like you can do anything about it while they're a baby, really, necessarily. There are some chiropractors and maybe even some physical therapists that work on children.
Okay.
So they're sort of pediatric chiropractors that work on children. They may be able to help with certain cases with very, very light manipulation to the spine, almost very subtle.
Okay.
And so that may help if they're a baby. Usually we won't really worry about it until they're more, past about 5-6 years old to see what their actual spine's gonna really look like.
Okay. So if they're having those, if you notice that their spine is a little bit off or their shoulders are off a little bit, is that something that has to be treated? Should they go and see a chiropractor?
Right. So I would say that you definitely want to treat that, because what happens is in the beginning it may be very subtle, but over time, gradually, a lot of times becomes worse.
Okay.
And if it becomes worse, then you have a higher chance of having headaches and neck pains and low back pain, and children might be having a problem running or walking. Their hips might go a little crooked, their shoulders are off, and it just seems to a lot of times get worse.
Okay.
And it causes a lot of problems with child education, because obviously if they're in pain, they're less likely to learn, they're less likely to enjoy their life, and you don't want to have that. So it's always good to take care of that while they're young, while they're growing, while they could change. Now, depending on how bad the scoliosis is, sometimes you do need bracing of the spine. Sometimes you may need surgery, because if the scoliosis is really bad, it could hinder on the heart and the lungs. It could stop them from taking deep breaths.
Oh, wow.
It cause asthma or heart issues. So those are factors that gets really significant, if it's really bad.
And so you mentioned that there's braces and then also surgery. What other, are those the only type of treatments?
Well, those would be, really, really bad cases. At first you want to bring it to a professional, maybe a chiropractor that has experience with scoliosis, which a lot of us do have. We take extensive classes in musculoskeletal disorders, and we can kind of, through x-rays, we would take an x-ray or send for an x-ray and figure out what degree of scoliosis it is, and whether it's something that should be addressed in a chiropractor's office or should be addressed, orthopedic surgeon, neurosurgeon, depending on the situation.
Okay, so there's different levels of treatment that can happen.
Right, exactly. So, but first you don't want to take it right to an orthopedic surgeon right away, unless you notice that it's a gross, posture. But you want to take it to probably a chiropractor first to get it checked out. And then from there, the chiropractor will advise, after taking an x-ray, will advise how bad the degree is. And based on the degree of the curvature, he or she can recommend, the doctor can recommend if you should see for bracing or orthopedic surgeon.
Okay. And is there a specific age that you would target to start that treatment?
So, I would say as young as possible, really.
Okay.
It's probably better to start about 5-6 years old.
Okay.
If you notice they're kind of off. If you notice, maybe sometimes I've seen children as young as 2 years old.
Oh,
When
wow.
yeah, and you know they're walking and one of their foot is off a little bit, right? So and they're kind of wobbling, and over time that may cause scoliosis. You know,
Okay.
so I mean, anytime there's a mechanical dysfunction, everything's attached, right?
Right.
So the spine. Neck pain could cause low back pain over time. Low back pain could cause neck pain over time. It's a chain reaction.
Okay.
So if your foot is off, your knee can get off, you know, be over time it can go inwards, can mechanical dysfunction in the knee, then hip dysfunction, go into low back and all the way up the chain.
So it's not just necessarily looking for that curvature of the spine. It's also just checking to see for your children to see if there's any other type of misalignment.
Right. Absolutely, absolutely. So you want to make sure that you know their knees aren't in, their hips aren't forward. One of their foot maybe, if they stand still, one foot straight, one foot that's this, you know, crooked this way, and then you might want to see like, why is that? Or maybe the other way around. So you want, you know, everything sort of has to be sort of even.
All right.
You know, if the shoulders are this way, why is that? Is there a problem in the shoulder here? Is it because of the shoulder? Is it because of the neck? Or is it because of the spine? You know, it could be a different variety of reasons for that kind of thing.
Okay, and of course that can help prevent, you mentioned scoliosis, if it's not already something that's genetic.
Right, absolutely, yeah.
That's great.
Yeah, absolutely. So if it's not genetic, then you know a lot of times scoliosis is, number one, we have to stop the progression of scoliosis, right? Number two, we can always treat it to a certain degree. Now, depending on how bad it is, it could become almost normal or normal to significantly better. And at the very least, we can stop the progression, because if it gets any, you know, at least, you know, maybe at that point they can live with it. But if it gets any worse, that's not good. Again, it could put pressure on the heart and the lungs and cause different more aches and pains. Yeah,
Okay.
throughout time.
So if there's those other concerns, you know, on the heart and lungs for a child, at least would they be okay to, you know, if they are or aren't getting treatment, can they still exercise? Or, you know, even teenagers, are they able to exercise with scoliosis?
Yeah, absolutely. Well, I mean, they can't exercise with scoliosis, depending on how bad the scoliosis is. You know, it would possibly cause more injury depending on the exercise. Now, if they're lifting weights and they have a C-shaped curvature or S-shaped curvature on the spine, they're lifting weights the wrong way, they're going to put pressure, they may injure themselves even more.
Right.
So you definitely want to know what type of exercise. Again, probably a professional, a doctor, doctor of chiropractic would be probably the best avenue to figure out what's the best exercise rehab. Should they be doing that exercise? And then there's a muscle imbalance involved as well. So it's not all skeletal system. There's a musculature. If there's a C-shaped spine, for example, you know, forward, you know, head forward carriage, and your back is kind of in a C shape, now that causes deformities. So some of the muscles are weak, some of the muscles are super tight. So we want to facilitate some of the muscles and inhibit some of the muscles that are too tight. You want to inhibit those, and the muscles that are not working, they're not pulling their own weight. You want to facilitate those so they start working properly, and they start to pull their own weight, because the other muscles get, you know, they have to take a brunt of things because some of the muscles aren't doing their job.
So some exercise could actually help.
Right, rehab,
that.
exercise,
Okay.
definitely. But, you know, just lifting weights the wrong way is not the right exercise. You have to make sure, you know, first you got to get diagnosed. Then you got to figure out what is the problem, which muscles are inhibited, they're not working, which muscles are too tight, and they need to be fixed.
Okay, and it's interesting you were mentioning also the C curvature. I think a lot of us probably think of just the misalignment. Maybe that's the S curvature, but there also is, if you kind of are bent over, that's also a sign of scoliosis.
Yeah. So there's two types of scoliosis. There's a C shape, which is hunching forward. There's the S shape, where the spine, as you're standing still, part of it go this way, parts of it go this way, and like a snake kind of.
Gotcha.
Scenario,
Okay.
yeah.
And so now, going back just to the treatments, if the doctor does recommend surgery, what is the best, surgery or procedure that you recommend for that?
So I would refer to the professional that actually does that. I wouldn't make remarks specifically for orthopedic surgery. I think that's a different arena that needs to be consulted with a good orthopedic surgeon. And there's a lot of different new technologies out right now
Okay.
that some orthopedic surgeon may know more about, may not know more about, and you definitely want to consult with someone that is pretty updated. Obviously, you can look at their background, look at their education, look at reviews. You can ask I know a lot of orthopedic surgeons. I know a lot of neurosurgeons, so I can definitely give good recommendation of where to go and who
Okay.
I think, few doctors that I think they should be
Great.
spoken with.
Which part to follow, right? So, of
Right,
course,
exactly.
the first part is to make that appointment and see you and see what type of care can be done
Right.
if needed. So, thank you for being here with us today, Dr. Eftihar.
Thanks for having me.
It's been a great program, and thank you for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and Virginia Medical Updates is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine to complement their expertise in medical care. Their areas of focus are in weight management, preventative medicine, and holistic health. Thank you again for joining us.
Hello, this is Dr. Kavian Milani for Virginia Medical Updates. Today, I'll be introducing the book called Smarter, Faster, Better. Oftentimes, we may wonder, why does a particular team work better? Or why does a particular team not work as well? What are the dynamics of motivation? What are the dynamics of successful planning? How do organizations succeed and create outcomes and happy personnel? And why do other organizations produce unhappy individuals and are not able to achieve much? What is the secret ingredient that makes some companies extremely successful and creative? Well, this book called Smarter, Faster, Better is a really very interesting read that comes. It is authored by Charles Duhigg. He is a author, and a previous work of his known as The Power of Habit was an international bestseller. He did really well with that book in terms of trying to explain what makes successful habits and how to develop habits that are successful. In this book, he goes a step further. This is a 2016 book, and it's just come out. The most interesting thing about this book is that it does present wonderful anecdotes on how, for example, Flight 447 Air France crashed, on how another flight from Quintos Airlines with engine fire did not crash, and what are the simple decision-making processes of the pilots that created a disaster out of nothing and actually was able to create a salvageable situation out of a real disaster. How do some companies like GE all of a sudden turn things around and using a smart methodology succeed? And what are the limitations to smart methodologies? So the whole process of decision-making, motivation, of successful teams, of forming ideas, of planning for future events, all of these items are really addressed in a very, very good method by this book. And the author does begin cases of anecdotes, and he takes the anecdotes further. And then at some point, what really develops, and it's interesting, is that he comes to some answer. And the answers are always informed by theory from sociology or theory from psychology. But the theory is not redundant, it is not boring, it is actually very exciting, and it's a light enough theory that basically it makes the whole process a lot better. So in general, this is a very important book. I suggest that every manager read the book, everyone who wants to lead a team read this book, and begin to implement some of the things that are discussed in here. For individuals that are kind of stuck in a rut, they're really not unhappy, they're not really doing very well. This book is also very good because it does create a fair amount of insight into how the human psyche works, and you see some good examples of motivation and some examples that are presented of tunnel thinking that the book does seem to want to expose and basically engage with and resolve. So the book in general is a very, very good book. I highly recommend this book, Smarter, Faster, Better. And it is a sequel to The Power of Habit, which did very well and was a very revolutionary book. But this book, I believe, is actually even a more interesting book. And I would put this definitely on my top 10 must-read books for 2016. Thank you for your attention. This is Dr. Kavyan Malani for Virginia Medical Updates. I look forward to hearing from you on social media and on my Twitter account at Dr. Malani or the program's Twitter account and Facebook. Thank you very much, and I look forward to seeing you in 2 weeks' time. Thank you.
Hi, my name is Farnaz Cannon and you are watching Virginia Medical Updates. Welcome to our show. Today I am going to introduce you to yoga, and I always say yoga is great for all ages. The only thing is you need to change the intensity. So let's not waste the time and start. As you see, I have a block here for the people that cannot do a lot of movement in yoga. This comes handy. So we're gonna sit on the floor and we're gonna start with a child pose. Open your knees wide and spread your fingers and reach along the mat. Keep breathing, and slowly we're gonna come to all fours. Tabletop, make sure your fingers are spread and your arms should be under your shoulders and knees shoulder apart, and slowly round your back. And gaze up, look up, chase, open your chest, and cow position again. And exhale, cow. You come to the neutral position and tuck your toes in. And slowly lift up your knees and come to the downward facing dog. Press your feet back. Fingers spread. Press your heels back. And keep breathing. And bend your knees and slowly walk to your hands. Pull forward. And bring your hands and place them on your shins. Heads down and round your back, and slowly stand up and bring your arms up. Hands to your heart and slowly fold forward. And step back right and left foot back. High push-up. Slowly, chaturanga, up dog, and downward facing dog. Left leg up, step forward, check your alignment, and if you're comfortable and steady, rise. and keep breathing. And step back, high plank, lower down, chaturanga, and up dog. And downward facing dog. Lower your knees slowly, and you're back to the first position, child pose. And slowly sit up. Thank you for watching Virginia Medical Updates. My name is Farnaz Cannon, and see you next time.